All right, so in this presentation here, I'm going to be talking about the MET and PNF stretching compared to conventional physiotherapy techniques and hamstring flexibility and its effect on chronic lower back pain. So in the study that I found, it examined lower back pain, and it showed that lower back pain is the leading disability among younger people, so less than 45 years old. 90% of adults will experience at some point in their life. 50% of them are reoccurrent, so it's a reoccurring injury. And conservative treatment focuses on flexibility exercises of the hamstring. So that's going to be your static, your classic hold for 10 to 15 seconds. That's what conservative treatment focuses on to improve flexibility in the hamstrings. So the idea here is that increased hamstring stiffness leads to increased lumbar flexion, which is just bad posture. So when we are going into movements that we have to bend over, this leads to increased risk of injury and a mechanical stress on the spine. So we want to avoid that by becoming more flexible. So increasing our hamstring flexibility will decrease lower back pain. So that was a correlation that was seen in previous research. And then what this study wanted to look at was the different methods in which stretching is applied. So they wanted to look at PNF, they wanted to look at PIR, which is also known as the MET, and then also the conventional static stretching. So that's what this study wanted to look at. So their method here was that they had 30 volunteers. They were both males and females. They had no history of musculoskeletal diseases, and they were about 20 to 40 years old. They were then split into three even groups here. The independent groups were based on what stretching they would do. So you had the muscle energy technique, or the MET or PIR group. You had the PNF stretching, which is your classic contract and relax stretch. And then the control group was a static stretching, so holding it for about 10 to 15 seconds. The evaluation was a pain rating scale, and then also flexibility measured by the Goini-meter. So that's going to be leveling their pain, and then also measuring their flexibility throughout the intervention. The protocol was a random selection of the groups. It was a pre and a post test, and the treatments were given 5 days a week, and the treatments were for 4 weeks. So that's how long the test was run, and it's just a classic pre and post evaluation of pain and flexibility. So what the research saw was the results for the pain scores. They were starting off the same, so that's good. They were all consistent for the pre-test, but the biggest and most significant difference was in the PNF score. So they all saw improvements in pain, or I should say decreases in pain. All groups saw this, but the most significant one was in the PNF group. So they had the most significant decrease in pain over the 4-week period. And then when you're looking at the range of motion, it was the same story here. So PNF had the biggest increase in range of motion. They all saw increases in range of motion, but PNF had the most effect and the most significant difference among the three groups. So the largest was in the PNF group. And then you can see on the graphs on the right, that was displayed there. So that was pre and post treatment. So discussion, the PNF group showed the most significant improvement in both pain reduction and improving flexibility. So the PNF group was the best, but all three groups did demonstrate pain reduction and improving flexibility and range of motion. This was explained that through autogenic inhibition. So this is what the Golgi tendon organ stimulation, and then that was provided by the isometric contraction and then the relaxing reflex of the muscle. So that's what was causing this PNF group to have the most improvements there. And then PNF and then the MET stretching provided increased benefits in range of motion and the reduction of pain when compared to the static stretching, or that classic hold for 10 to 15 seconds. So both PNF and MET had greater improvements in those fields. So the conclusion here, performing MET and PNF static stretching increases hamstring flexibility, decreases pain, and it improves range of motion. All these factors would reduce chronic lower back pain. So the image on the right is an example of PNF stretching. So what it showed was that PNF was the best at improving range of motion and decreasing pain, but all of the stretching methods did have an effect on those factors. So that was pretty much what the study showed, and hope you all learned a little bit there. Thank you. And there is the references there.